Hello, everybody, and thank you for joining us for this very important interview that I'm having today with Dr. Stephen Hussey, a cardiovascular health expert. Hello and welcome.
Thanks for having me. I'm happy to be here.
So, Dr. Hussey, can you start by sharing a little bit more of your background and what led you to eventually become this expert about cardiovascular health?
Yeah, definitely. So I guess by trade, I'm a chiropractor and functional medicine practitioner. And my passion for heart health was created through my own health journey, I guess. So as a child, I had a lot of inflammatory conditions, everything from IBS to allergies to asthma. I used to like break out in chronic hives all over my body. And ultimately ended up with autoimmune type 1 diabetes, where my body was so inflamed that it attacked my pancreas. And now those cells that make insulin don't make insulin anymore. And so I'm type 1 diabetic. And so, you know,
At what age?
At 9 years old was when that happened. Yeah. And so, my parents and I were kind of thrown into this world of Western medicine to help us, figure out what's going on with these conditions. And it didn't really help us figure anything out about what was going on with those things or why they happened. Just helped us kind of manage them. And so as I grew up, I learned through my physicians and through my own research and stuff that being type 1 diabetic, I'm heavily predisposed to heart disease, as well as other diseases, but especially heart disease. And so I've always kind of tried to figure out why that is. And I've always been doing research to trying to prevent that kind of thing. And so as I was in college, I started getting a passion for health. And I realized that the way I live my life and the choices that I made and as far as health goes, directly impacted my ability to manage the conditions that I had. And I'm happy to say that I got rid of, almost all of those conditions aside from type 1 diabetes, which is kind of the collateral damage from that inflammation. But yeah, free from all those inflammatory conditions now. But I've kind of, every time heart disease came up, I've always, my ears perked up. I've always tried to soak in as much as I could. And I did a lot of independent research. And then throughout my medical education, I didn't really learn what I wanted to. So it's always been this passion, this drive of mine to kind of figure out as much as I can about heart disease. And a lot of what I found was very shocking, very surprising, very contrary to what the, conventional wisdom is. And so I started sharing that a while back, maybe over 4 years ago now. And people seem to like it. And so I eventually wrote a book, which just came out this month. And here we are.
Yay, congratulations on the book. I'm going to link everything, obviously, in the description box. So, Dr. Hussey, what causes heart disease?
Well, so in my book, I kind of take this three-pronged approach, and it's very convoluted, and lots of these imbalances kind of interweave with each other. But if I had to break it down into three things or three imbalances in the body that create heart disease, one is having poor metabolic health, or being insulin resistant, which insulin resistance is, the trademark of like type 2 diabetes. So that, and then being in a state of oxidative stress or inflammation, which kind of go hand in hand. They're not quite the same thing, but they kind of go hand in hand as far as damage to the body. And then thirdly is an imbalance in the autonomic nervous system, which is the system in our body that kind of senses our environment and tells your body if it's in a safe or threatening situation, so your body can kind of react to that appropriately. So imbalances in those three things are, I think, the drivers of heart disease.
And based on that, what are some of the things that you have implemented personally to minimize as much as possible your risk for heart disease?
Yeah, so well, I mean, if we take those three imbalances, one thing that I implement is, and this is something that has been kind of something that I do easily, which is, I'm very strict about diet. It's easy for me to be strict about diet and not eat things that I don't think serve me. And so but diet is the number one way to create metabolic health, which is that first imbalance, the number one way to prevent insulin resistance. So if you're eating in a way that prevents insulin resistance, so the connection there is that people think that cholesterol or something, clogs arteries, but that's not necessarily the case. I don't think it's the case at all. What does happen is we get damage to the lining of arteries, and that's something that's more or less supposed to happen. It's just normal wear and tear. It's the ability of our body to repair that damage in a timely manner that that is really important, so we don't develop atherosclerosis down the road. However, when we become insulin resistant, like the lining of those arteries, it repairs itself through insulin signaling. So if we become insulin resistant, that signaling doesn't happen and we don't get that repair, and the body is forced to repair it some other way. And the only way it knows how is to kind of use, minerals and cholesterol molecules. It's almost like spackle to kind of patch up the damage that's happening on the lining of those arteries. And that's when we get to development of atherosclerosis. So that's why being metabolically healthy is so important. And so, diet is, there's no one supplement that's going to cure insulin resistance. There's no procedure or surgery that's going to cure insulin resistance. It's diet that does that. And the main things, like if people didn't do anything else dietarily, if they just got vegetable oils, processed grains, and processed sugars out of their diet, they're going to be doing, 75% of the battle with creating metabolic health and preventing insulin resistance. So that's one thing that I implement very strictly is what I eat, because that's something I can definitely control. Yeah.
So what would your typical meal plan look like?
Well, I don't eat in the mornings usually. Sometimes I will have some coffee, but that's not every day. But I don't usually eat in the mornings, and sometimes, most of the time, that coffee is just black anyway, so it's not going to mess with a fast that I would be having. And so it's kind of an intermittent fasting type thing. And then at lunch, usually my meals, are heavily animal based. It's some type of animal protein, some type of muscle meat, whether it's pork or chicken or beef. Beef is probably the preferred one. And then sometimes I'll mix in some vegetables. Not always. I'd say my diet's probably like 85% animal based right now. Yeah, and then I'll put cheese and stuff on top of it, just variations of those types of things, I'll do lots of bone broth. Sometimes I'll take bone broth with me for lunch. And then in the evenings, I'll do different variations. I'll cook roasts, or I'll make an omelet with just animal foods, and maybe a few vegetables or something, maybe an avocado, that kind of stuff. I'll do some small fish like sardines. I'm trying to think what else. That's pretty much it. Yeah, it's just centered around animal foods and animal fats, and I sprinkle in some plants here and there.
So you're not doing low fat, obviously. You're consuming the actual fatty portion of the meats. You're not scared of the saturated fat or of the cholesterol, which I'm obviously going to ask you about those, but since we're talking about your diet, do you take any supplements?
Yeah, I take a few supplements, magnesium, and berberine, because as much as I can almost doubt kind of the antioxidant and the phytochemical theory of things, I have seen benefit in blood sugar regulation as a type 1 diabetic taking berberine. So I do take that. I started taking that about a year ago, and I saw a difference. And then I also take liver capsules, so grass-fed liver capsules. Yeah. That's what I'm doing right now. Sometimes I'll take some what's called wabein, which is just a molecule that the kidneys kind of produce, but it's also found in a seed extract of a different plant, and that increases parasympathetic activity to the heart. So sometimes I'll do that if I'm stressed or something like that.
So I think I should have asked you this earlier when you were talking about how being a type 1 diabetic increases your risk for heart disease. Just exactly how much more risk does that increase? Because I feel like it has to be meaningful for you to focus on it so much, right?
Yeah, I mean, well, it's anywhere from 2 to 4 times the risk, depending on lifestyle.
Right.
So I'm hoping I'm more on the 2 range, and the reason that is that no matter how hard I try, my blood sugars are not going to be as normal or as stable as someone who's non-type 1, because I'm trying to act like a pancreas, and I'm injecting insulin into muscle or fatty tissue, and like my pancreas is injecting right into the bloodstream. So it's just different delivery, but also different absorption rates, and it's just not that honed in mechanism that my body has for regulating blood sugar. I'm trying to do that myself, and so so no matter how hard I try, there's going to be fluctuations, and it's the fluctuations, the ups and downs in blood sugars, that tend to cause more damage to the lining of the arteries, but also higher blood sugars cause more what's called glycation, which is just damage to different things in the body. That's what the A1C is measuring damage to red blood cells through glycation. And so yeah, there's just, I'm more prone to those types of things pretty heavily. I mean, twice the risk is good, but 4 times the risk is a lot. So
yeah, I see. Okay, so moving back to what we were talking about with supplementation, do you take, other than the stuff that you mentioned, vitamin D or omega-3, any form of omega-3? And why
no,
not?
I try and get most of my vitamin D from the sun, which is where I think we're designed to get. It's not always possible in the winter, but I've actually never really supplemented with vitamin D. However, I will say that if people do supplement with vitamin D, it's very important to have enough fat in your meal when you do that, because you got to stimulate bile for the absorption of that fat soluble vitamin D. And so I've seen so many people who are taking like 10,000 IU a day of vitamin D and just doesn't change their levels at all. And usually it's because they're taking it on an empty stomach and there was just no bile secreted, so no absorption was happening. So I will tell you that. And then what else you say? You said vitamin D and
omega-3.
Omega-3. Yeah. So I'm actually not a fan of omega-3 supplements because I think they're very highly oxidized. They're very highly damaged. Once you remove them from the fish or wherever they came from, they're very sensitive to light. They're very sensitive to heat because they are unsaturated, which makes them less stable than, say, a saturated fat. And so the other thing is that, there's this craze of supplementing omega-3s. And I don't think that's necessarily the issue, because we want a good ratio of omega-3 to omega-6s. And the problem is that there's too many omega-6s in the average American diet. So really we should be decreasing the omega-6s, which are, the linoleic acids and the vegetable oils. Those are the real problematic things, rather than trying to even out the ratio by, dosing huge doses of omega-3s. We should really just reduce the omega-6s.
Yeah, I agree. And I agree with you 100% that the first line thing that we need to focus on is those industrial seed oils like the sunflower, safflower oil. Remove those, and also grains, and also conventionally raised meat even. All those things add up. They bump up your omega-6 level. And so now you're taking some omega-3, but if the amount of omega-6 is so much higher, which is the case on the standard American diet, I mean, we're eating 20 to 25 times more omega-6 compared to the omega-3, then you're not really getting any benefit there. And you're probably ingesting rancid or oxidized fish oil. So that's another thing that we need to pay attention to. So do you also check continuous glucose monitoring just to see, if you can get more control over the blood sugar variations?
Definitely. And for a type 1 diabetic, that technology has been a game changer. Because before, just like, I tell people that, like, blood work is useful, but it's one snapshot in time of a specific instance or a specific time in your life, and it's telling you what your levels of things are in that time. But things are fluctuating all the time. And so it's really hard to, gauge what to do about, say, that one snapshot in time if you don't know what's going on, throughout the day. You don't know your trends. And it was the same way with testing for blood sugar. Like, I was taking my blood sugar, 5 or 6 times a day, but it was just these snapshots in time. So I didn't know if it was going up or going down, or what was trending, what it usually does during that time. And so with a continuous glucose monitor, it's been really informative. And really, I'm able to kind of predict what's going to happen more based on the trends that I see every day. And it also tells me, is it at this level, going up, going down, staying level? So I can kind of give my insulin accordingly, which has been a huge game changer. And, for other people, people who are non-type 1 diabetic, it's useful because you can see how certain foods affect you more than others, like what is leading to those spikes in blood sugar. But spikes in blood sugar are supposed to happen with certain foods that we eat, but having it happen repeatedly could be not the best thing in the world. As far as, I remember I said earlier, it's those fluctuations that can cause damage, but especially useful for someone who's been diagnosed type 2. But yeah, for me, it's been a huge help.
Was there anything surprising that you learned from the CGM monitors that you didn't realize was affecting your blood sugar so much with just taking the traditional way of,
well, not necessarily any particular food that I ate, but what I did realize with a CGM is that I do think I have a little gastroparesis, which is just delayed stomach emptying, because there'd be times where I would eat a meal and give myself the insulin that I thought I needed for the meal, and I would go low because I gave too much, because it wasn't leaving the stomach as fast as it should have. And then, so I would correct that low with a little bit of some sort of glucose or carbohydrate, and it level back out. But then later it'd start going up after, and I haven't eaten anything.
Yeah.
And so I'd realized that it was later that came out of the stomach, and then it raised the blood sugar then. So it helped me kind of gauge that a little bit and know when to dose my insulin a little better. But then also things that I realized, and I kind of knew this before, but I realized the significance of it is even things like stress or exercise will make my blood sugar go up. And I can see it on the CGM much easier than if I'm just randomly, because before I just randomly take a blood sugar, just one snapshot in time, and I was just like, oh, I must not have given enough insulin for the last meal I ate. Whereas with the CGM, I can see I did give enough insulin for that, and it was level, and then I worked out and it went up. And so I know now I can dose for that kind of stuff too, much easier.
So how are your workouts?
Well, it's mainly a little bit of aerobic, like just really just like walking or on the bike or something like that. I like to cycle, but mainly it's resistance training. I think that's the big thing as far as creating insulin sensitivity, building mitochondria in the muscle, that kind of stuff. It's mainly just resistance weights. And then I'm not doing it as much anymore, but I also like to play soccer and various sports and things like that.
Okay. You mentioned that you added vegetables. Do you, or have you looked into the research linking lectins or anti-nutrients in plant foods, and if that can affect heart disease in any way?
Definitely, yeah. Main way that it does it, and I write about this in my book, is that it can cause leaky gut. And for some reason, like the heart and the gut seem to be the most, I guess, innervated by the vagus nerve. I mean, all the organs are, but they seem to be really heavily innervated by them, by the vagus nerve. So like, it's almost as if, the gut's kind of this external environment inside our body. It's kind of sealed off all the way through. And it's kind of a way that your nervous system is detecting what the external environment is a little bit. And so if you've got a damaged, inflamed, hostile gut, you're getting your body's sending signals from the gut to your brain, this hostility. And so lectins are one way that we do trigger that hostility. And so, gut issues were a big issue of mine for a long time throughout my life. And it was much improved when I started changing diet and just eating better in general, getting away from the standard American diet. But when I was carnivore, that was the first time in my life I had no gut issues whatsoever. And I'm happy to say that since I've added some vegetables back in, not a lot, it has stayed. Like there's no symptoms, right? It's almost like doing carnivore. I did almost 2 years, allowed my gut to heal. And now, and that doesn't mean that maybe it won't go back one day if the vegetables were the trigger or something. Right. And that doesn't mean that and I can always go back to carnivore if that was the case or something, but it was like this thing that allowed my gut to finally heal. And once it did that, it was able to withstand, a little more variety.
And when did you do the carnivore 2-year thing?
I stopped probably a year and a half ago now, maybe a year ago. But yeah, I did it for about a year and 10 months. And then stopped, I think.
Strict, like nothing, no plant foods, just meat.
Yeah, just meat. Just meat and eggs, and I did a little bit of cheese, and sardines and things like that, and bone broths. It was just animal foods for a year and 8 months. And it was the first time in my life I had no gut symptoms. I mean, they were already way better than they had been before because of other diet changes, but it was the first time they were completely gone, and they stayed gone. And then when I added back different vegetables, they stayed gone. They haven't come back.
Wow. That's amazing. And that's good for some people who might feel like they do want some more variety. Like it's not something that you must stick with for everyone for life. So that's great. Okay. I wanted to ask you this because you posted about it on your Instagram and I thought that was interesting. Why is heart cancer rare?
It's kind of a long answer. I think there's two reasons why. And the first one I call like the metabolic reasoning, I guess, or the heart has this special metabolism that seems to protect it from cancer. But the second is more of a physics side of things. So like we talk a lot about biochemistry because of diet and supplements and medications, and that's what we study when we study those things is biochemistry. But our body also has this very physics side to us that we should pay attention to when it comes to health. And so there's certain characteristics that have to do with metabolism of the heart that I would call it the physics side of things. But as far as the metabolism side of things, heart tissue, heart muscle cells are unique in a few ways. One, it seems that they prefer fatty acids and ketones more heavily than most of the other tissues in the body, because there's studies that show that even in the presence of glucose, the heart muscle tissue will use fatty acids and ketones, even whereas usually we have to restrict glucose to get the body to upregulate ketone production and fatty acid utilization. And but that doesn't seem to be the case for the heart. And so there's that. But then, also the thing about the heart is that at some point during our evolution or whatever, there seemed to be this trade-off where like the heart is a very metabolically active organ. Some of the highest concentrations of mitochondria are in the heart tissue because it's always contracting. It's always using a lot of energy. But it traded off in that like that high metabolic demand, and it kind of sacrificed its ability to actually make new cells. So most of the other tissues in the body can, the cells can divide and they can make new cells and it can kind of regenerate. But the heart cells we're born with are the heart cells that we're going to have, and we're not going to make any more, which is why a heart attack is such a big deal, because if some of those heart cells die, we don't necessarily get them back. We can try and repair those cells as best we can, but if they die completely, we can't get them back. And so there's this situation that happens where there's heart attacks that can happen without a blockage whatsoever. And it has to do with shifts in metabolism due to high stress to the heart. So when we get high stress to the heart, we have these levels of oxidative stress that can send the stress signals to the heart that actually signals for it to burn more glucose than it wants to. Because remember, it prefers fatty acids and ketones. But just like if you go for a run and you start to burn that glycogen store in your muscle, and you start to feel that lactic acid and that hydrogen ion burn in your muscle because you're burning more glucose, the same kind of thing can happen in the heart in this situation. If we get that surge of stress activity to the heart, it starts to shift to burning more glucose than it wants to. And that causes this, what we call it angina, chest pain. To me, it's not always this restriction of oxygen or blood flow to an area. It's a shift in metabolism that's leading to lactic acid and hydrogen ion build up in the tissue. And when that happens I don't know if you're familiar with like the metabolic theory of cancer and how when we have a breakdown of metabolism, the heart or the mitochondria and the cells themselves actually shift to this fermentation state, which is a cancer state, which is what we see in cancer cells. They're anaerobic. They don't use oxygen very well. And so this situation that I'm talking about where high stress happens to the heart and it causes that shift in glucose, well, usually that it would convert to a cancer cell, right? And what's a characteristic of a cancer cell is that it's rapidly dividing. Right. It's undifferentiated, it's anaerobic. But remember, I said the heart cells they don't divide, they don't reproduce, they can't make new cells. So when that happens in a heart cell, it dies. It can't. And so whereas in a cancer cell and other tissues in the body, it starts to rapidly divide and become cancer, which is problematic long-term, but short-term, it's a fix to that problem, that metabolic problem. Long-term, it's cancer that will kill us. But in the heart, that doesn't happen. That shift in metabolism happens and the tissue dies because it can't divide. So that's why one reason why heart cancer is so rare is because those cells don't divide, and that's the characteristic of cancer. And it all has to do with shifts in metabolism. So does cancer, but this is a shift in metabolism that can cause tissue death in the heart.
Very interesting. Thank you for shedding light on that. Because I did not know any of this whole concept. So let's first start with cholesterol.
Mm-hmm.
Why is cholesterol not to be feared? Because when we tell people animal-based is great for you, carnivore diets are wonderful, the first question is, but what about the cholesterol?
Yeah. Well, so there's lots of evidence that, dietary cholesterol doesn't necessarily affect blood levels of cholesterol. It can, and we do see it in some people, but lots of people eat, like on carnivore diets, eat tons of cholesterol. It doesn't affect it one bit, which tells me that, your body's regulating it the way it sees fit, right? So your liver makes a lot of cholesterol. So even if we didn't eat any cholesterol whatsoever, your liver would make a lot, because it's absolutely necessary for life. And really, really important for lots of different functions in the body. But the idea that cholesterol causes heart disease came from this idea that saturated fat was the cause of heart disease, based on some very bad science back in the 50s and 60s. It was associational science that showed that more countries that ate, animal foods and saturated fats and things and had higher cholesterol, had higher rates of heart disease. But what they didn't tell everybody, there was a lot of data available at the time, and only some data was used to perpetuate that theory. And so it was some bad science. It was some cherry pick science. But by the time that they fleshed it out and tested it, the theory had taken off, and there was a lot of money behind it, a lot of money to lose if the theory went down. So it's kind of stuck, and that's where we're with today. But when you look at the actual, like what happens in an artery, the conventional wisdom, or what people are taught in medical school, and just told in general, is that high levels of cholesterol will start to, stick together and glob up on the side of an artery and start to build this clot, or this atherosclerosis, this fibrotic plaque onto the lining of the artery. But there's really just no evidence for that. The evidence that we have that cholesterol causes heart disease is almost zero. And the only thing we do have are associational studies that say that maybe some higher levels of LDL are more associated, not causing, but just happening at the same time, causing atherosclerosis. And that's the lowest form of research there is, because you can't draw conclusions from that. But there's also plenty of research that suggests the opposite, that show that just depends on how you do the study, how you mess with the statistics. You can show that high levels of LDL cholesterol in the blood do not associate with atherosclerosis or heart disease. So that type of science is just weak, and we should really just not use it to base our opinions. But yeah, so there's really just no evidence for it. And then when you look at what actually does cause heart disease and why cholesterol does get deposited on the lining of the artery, it's because there's inflammation and oxidative stress and damage to the lining of an artery. And so that's the real culprit. It's why people talk about things like LDL particle size, or they talk about Lp(a), or oxidized LDL, or ApoB, all these different terms, all these different subcategories of cholesterol molecules. And all those things are indicating that there's damage to cholesterol. Right. And so, yes, those things have been shown to be associated with higher levels of atherosclerosis, not because those things themselves are causing atherosclerosis, but because when we have the presence of those things, that means there's something damaging them. And that thing that's damaging them is also damaging the lining of the artery. Mm-hmm. And so we can tell that something's damaging it by testing those numbers. But we have to ask ourselves, what's the thing causing that damage? And that's the inflammation and oxidative stress that we get from psychological stress, from eating a poor diet, from exposure to toxins in the environment, from all kinds of different things, vegetable oils, smoking, sedentary lifestyle, like all these different things that lead to this inflammation and oxidative stress. And those are the real culprits in heart disease.
Yeah. And I had no idea. I mean, I guess it makes common sense when I think about it, but I remember on your Instagram not too long ago, you posted a study about, I think it was South Korea and pesticide use, mm-hmm. and how that is, obviously it's association, but still it's associated with higher rates of heart disease. So, there are so many things, and that's just one form of toxin. I mean, we've got tons of environmental toxins, you go and you live in a place where you've got mercury, if they're still using power plants, for example, coal-powered plants to generate energy, then you have mercury emitted into the environment, and then you're breathing that in. The deodorants that you're using has got aluminum, right? Unless you get the specific one. So there are so many things one can do, but diet definitely plays a huge, huge role for sure. I wanted to ask you, what is the difference between LPA and small dense LDLs?
So to me, they're both characterizing the same issue, which is there's damage to LDL molecules, because when an LDL molecule gets damaged, it gets smaller. It's still never going to get as small as an HDL molecule, but it does get smaller when it gets damaged. And sometimes the body decides to put this little protein, this little A protein on it, and it becomes LP little a. Other times it's just left alone and it's just this smaller dense molecule, and we call it small dense LDL. Or even when an LDL molecule becomes damaged or oxidized, we call it oxidized LDL. And all of these things are just different to me, in my opinion. They're just different ways of saying, okay, we've got damage to LDL molecules. But we need to ask what's causing that damage and what else is it damaging, like the lining of the artery.
Interesting, very interesting. And I think also Dr. Paul Mason talks about the same exact thing in a presentation where he shows how the LDL becomes small dense and the LPA, happens as an indirect measure if you want to check to see if you have damage to those particles. They're like indirect measures of increased risk for heart disease in a way. And this is something that I don't know, but let's see. Why do you think we never see atherosclerosis in veins, only in arteries?
Right. So it's because, remember, we're talking about this damage that happens in the lining of the arteries because there's inflammation and oxidative stress. So if there's things in the bloodstream, things like free radicals, which are molecules with unpaired electrons that like to be paired. I call them like the Looney Tunes Tasmanian devil. They're going around just damaging things, looking for a paired electron, and they'll steal it from anywhere, and including the lining of the artery. They'll steal it from that. And that causes damage to the lining of the artery when it does that. And so there are lots of things that can act like free radicals, whether it's those pesticides you talked about, or the heavy metals you talked about, or damaged cholesterol molecules. Even though they themselves are not the reason for the damage in atherosclerosis, when they get damaged, they can act like free radicals too sometimes. Mm-hmm. And so there's just various things floating around in the blood that act like free radicals that can cause this oxidative stress. And so the reason that we see the damage from those things happening in arteries and not veins is because of pressure. So the arteries are under much more pressure. And so those things that are inside the artery, when the blood goes around a turn, or when the artery splits into two different arteries, that's where we see atherosclerosis, because there's pressure in those arteries, and all that stuff that causes oxidative stress is bumping into the lining of the arteries when it curves like that, or when it splits. And that's where we see atherosclerosis more commonly, is when in those places like that. And because there's more pressure in the arteries, because that's where the tissue demand is greater, tissue demand for blood. And the arteries can expand and contract to increase or decrease pressure based on what it needs. Whereas in the veins, they're much thinner. There's less muscle in the vein, that can contract and create more pressure. And so we just don't see it, right? The only time we see atherosclerosis in veins is when there's a bypass surgery, when someone takes a vein and puts it into the coronary arteries to bypass a blockage, which in my book, I talk about why those things have failed for the most part at preventing heart disease and stuff. But when we put a vein into the arterial system and make it act like an artery, it gets atherosclerosis very promptly, because there's more pressure. It's on the wrong side now. It's not on the venous side, it's in the arterial side.
Wow. See, I never knew that. The last thing I had read about that, they just said it never happens in veins and we don't know why. And that's why I wanted to ask you. So I had no idea that they can actually do that. And then it can actually develop atherosclerosis. That's very interesting. So something that I missed, triglycerides. higher triglycerides, especially on a carnivore diet or even keto diet. What are your thoughts on that?
So if you have high triglycerides on those diets, it may mean you didn't fast long enough for your blood test, because Dave Feldman has shown that they tell you to fast 8 to 10 hours usually for a blood test, whatever. But if you don't fast 12 or more, there's a high chance that the meal you ate isn't quite out of the bloodstream yet. So there's higher triglycerides there. There's still high triglycerides there. So you just want to make sure you're fasting long enough first. Otherwise, it's pretty rare to see high triglycerides on a ketogenic or a carnivore diet,
right?
Because it creates metabolic health. And the reason we get high triglycerides is when we have insulin resistance, because insulin sensitivity in the body is very good, but we actually want insulin resistance in our fat cells. We don't want them taking in a bunch of energy from using insulin to take in a bunch of energy. And so when our fat cells become insulin resistant, they send out signaling molecules to the rest of the body to become insulin sensitive, which is what we want. However, if we're eating vegetable oils and processed carbohydrates, grains and sugars and things like that, then that does not trigger satiation, and it actually signals to the fat cells to become insulin sensitive, and they start taking in a lot of extra energy, and they convert it to fat and store it as fat. And everybody has a different fat threshold. And so when your fat cells get to the point where they can't hold anymore, they actually start spewing out fats, or that triglycerides, which is a fat molecule, can't be stored and ends up in higher amounts in the bloodstream. This is why high triglycerides is an indicator that there's insulin resistance in the body, because there's insulin sensitivity in the fat cells, so much so that they can't store anymore. But the fat threshold is very important, because someone can be super skinny, have a really low fat threshold, and be type 2 diabetic because they reach their fat threshold very quickly. Whereas someone else could be very overweight and not have reached their fat threshold yet, and not be type 2 diabetic yet, or not be insulin resistant yet, because their fat threshold is very high. So that's where genetics does play a little bit of a role in who becomes insulin resistant and when.
What are the best tests that you would recommend if somebody wants to check for their risk for heart disease?
Yeah, so just along those three imbalances, so the first one, we want to test for metabolic health. And the two best tests for me there are a fasting insulin level and a trig to HDL ratio.
Triglyceride to HDL.
Yeah. So trig to HDL ratio should be 1.5 or lower. And the fasting insulin, a good number is like below 10, but like below 5 is probably optimal. And you can take, that fasting insulin level, you can use the blood sugar number as well, fasting blood sugar, to calculate your insulin resistance score. You can do that too, but generally the fasting insulin is pretty good. You don't have to calculate that score. So that's the best things you could look at for metabolic health. You could look at free fatty acids too, or you could look at what
about the CAC scan?
The CAC score?
Yeah.
So that one, that's just like a CT scan of your heart, looking at hardening of arteries. So if there's calcification of an artery in your heart, which is kind of like end stage, that means that there's been atherosclerosis there, so much so that your body decided to calcify it to stabilize it. So it's not really going to test for soft plaques. It's going to test, it's useful because it tells you if you have atherosclerotic buildup in the arteries, but it doesn't really tell you how much soft plaque is. The soft plaque is the dangerous stuff. That's the stuff that can break off and cause clots and then blockages, which is not the only way a heart attack can happen, but it is one way that it can. So the CAC score can tell you if you have hardening of the arteries, and if you take subsequent ones, it can tell you if you're doing the right thing or the wrong thing, because if you take one and then it's worse next time, you're doing the wrong thing. But to me, I would want something that's going to tell us more about the inflammation and lining of the artery, and the soft plaque and how unstable that is. So those could be things like LP, PLA2, or myeloperoxidase. Those things are better at telling me how inflamed are the arteries right now. Is there going to be a rupture there, or maybe a soft plaque rupture even, which would be worse. those types of things. But then that goes into like the things we want to test for, like inflammation and oxidative stress numbers, which the best general number for that is high sensitivity C-reactive protein.
Yeah.
And then, but you could get into the weeds with testing for inflammation and oxidative stress. You could test for like damage to fatty acids. You could test for damage to DNA molecules, like oxidative stress damage. I like to take a liver GGT test that tells me about kind of oxidative stress in the liver and how stress and how much that's having to handle. But then the one that people don't talk about a lot is the last imbalance, is the autonomic nervous system, and that's heart rate variability. I think that's really important. That kind of measures balance in our stress response. There's no mistake that the way we measure that is through the heart, because the heart is one of the most connected to our stress response and to our emotional state. So heart rate variability is something that you can track with various devices that I think is incredibly important for health.
Great tips. I used to measure heart rate variability back in the day when I would buy all the gadgets and all the tools and all the hacking stuff. I remember I got the Polar heart rate monitor because it's like the gold standard. We use that at the University of Miami, like when we're training athletes and testing them in the lab. So you can do that and just download it. There are free apps everywhere. As a matter of fact, I think the Polar app can do that also for you, and it'll check heart rate variability, which is basically how much time is in between heartbeats. And you would think that the more regular, the better, but it's actually the opposite, right? It's like the more variability, the better.
Right. The more variable. So think about it this, like the definition of health to me is the ability of your body to adapt to different situations. And so if your heartbeat is just stuck in the same rhythm and something stressful happens to you, it can't adapt to that. Right. So we want it to be variable a little bit. We want it to be able to go to one end and the other, because then it can go back and forth. It can adapt to different situations. It's the same with metabolic flexibility. We want the ability to be able to adapt, or the body to be able to adapt to different fuel sources, right? We want metabolic flexibility. It's just at its core, the definition of health is the ability of the body to adapt to different situations. And so that's what heart rate variability is measuring, is your ability to go back and forth from a stress and non-stress state and to handle it okay.
So with regards to metabolic flexibility, if you're training your body to become more metabolically flexible, the vast majority of the time we have an issue with too many carbohydrates. So we're training them to enter a state of fat burning or ketosis. So we're lowering the amount of carbs. But as you lower the amount of carbs, let's say you do 0 carbs or a carnivore, right, for 2 years, and then you eat carbohydrates, you've lost some of that adaptation, right? And so now you're going to respond, you're going to freak out a little bit more when you have some carbohydrates. So what are your thoughts on that? And what do you think is the best route in that aspect?
Yeah, so you can become metabolically inflexible both ways, right? You could have, so your body usually, except for the heart, like I talked about, usually if there's carbohydrates, glucose present, it'll burn that first, more or less. It may do alcohol first, but then it'll do protein and then fats. And so we have to restrict carbohydrate in order to get to the other fuel sources, to make the body force it to burn those other fuel sources. And so, but if we always have carbohydrate with, especially processed carbohydrates with meals, it's always going to burn that first, and the other stuff's going to get stored. And it almost forgets how to burn fatty acids, and it downregulates mechanisms of making ketones. Right. And so when we go on a ketogenic diet, that's why there's this phase where people call it like the keto flu, because you're literally taking your body's fuel source away, which is glucose, and it has to learn how to burn other things. So we might get fatigue, we might get, dry mouth as we burn through glycogen stores, things like that. And so we become metabolically inflexible because your body only burns carbohydrates and it forgets how to burn the other things. And it can take, 2 to 6 weeks for your body to upregulate mechanisms to be burning fatty acids and ketones again when you restrict carbohydrates. But just on the other end of things, if you restrict carbohydrates severely, like, true ketogenic diets where 70% of your calories are from fats, and you do that for a long time, your body can forget how to learn or how to use glucose to an extent. However, if you ate glucose again and you did it for a day or two, your body's going to remember how to use that much easier than it would burning or making ketones and burning fatty acids. So yes, if you are on a very strict ketogenic diet and you do like an oral glucose tolerance test, it's going to look like you're insulin resistant because your blood sugar is going to go up a little bit, and it's going to stay elevated too long. But if you started eating a moderate amount or even a small amount of carbohydrates for a day or two, that's not going to happen anymore. You're going to be right back where you were. So it's much better to be metabolically inflexible in the fatty acid ketone category where you're only burning those than it is to be metabolically inflexible just burning glucose, because just burning glucose, you're going to have higher rates of oxidative stress. You're going to make less energy, less ATP per molecule of glucose than if per molecule of fat. So there's definitely advantages to being metabolically flexible or inflexible in the fat burning category than in the other one.
Yeah. So I guess if somebody asked you, do you recommend that I continuously add small amounts of fruits just so that, because I'm afraid that I'm going to become so metabolically inflexible because I'm only eating fats and proteins, what would you tell them?
I tell them that's dependent on the person, because some people, it seems like, do better with a little bit of carbohydrate. Whether it's with workouts or just energy, some people just seem to do better, whereas other people can do keto all the time and they're fine. So it's really dependent on the person, but I would never tell someone that you have to have some carbohydrate because you're going to be too metabolically flexible the other way. Because I don't see a long-term issue with that. It just really depends on the person.
Yeah. And I also feel that sometimes when people reintroduce some carbohydrates and now they feel great, it's kind of like giving your body some steroids. Yes, you're going to perform better, of course, but that's like a short-term effect. And that's my opinion. I just feel like maybe sometimes if you just give the body enough time to bring back that performance level back up again to what it was before you started the lower carb diets, then you might feel like not only did your performance go back up again, but you might even exceed your performance before that. And I got that from Dr. Stephen Phinney and Dr. Jeff Volek, the book, The Art and Science of Low Carbohydrate Performance, where they talk about how athletes generally, or any person really, generally require 3 months of keto adaptation for your performance level to go back up to where it was before shifting your fuel source on a ketogenic diet. So I think that would be my advice, like be patient, because you might feel great on carnivore or very low carb and feel like, oh, but what about my workouts? So time it outside an athletic season if you can. That would be ideal, and be patient with it. Allow those 3 months to pass by and then make that decision.
Yeah, and cater your workouts too. Like, don't try and go super hard and work out just like you were while you're adapting. Give yourself some time and don't wear yourself out. But yeah, and even then, some people express concern with like glycogen stores being replenished after hard workouts. But I believe it was those two authors that did that study where they showed that that's like people on ketogenic diets. Yeah, it's the same. Like, they're able to replenish glycogen stores just fine.
Exactly. It's almost as if they don't even tap into it, or they tap into it and then I don't remember the details of the study. Those were, I think, 2 years into ketosis athletes, and they measured their glycogen stores before and after an exercise bout, and their glycogen stores were just as full as the carbohydrate consuming athletes. So that's another thing to pay attention to.
Definitely.
Great. Yeah, because I remember when I first started teaching, I first started to teach, I would teach nutrition at the University of Miami before. Now I teach at Miami-Dade College, but back when I first started teaching nutrition, I was starting to get into keto and low carb diets, and I would tell my students about that because I would be very excited. And I always had student athletes, and the first question that comes up is, well, what about my athletic performance? Can I do keto if I'm an athlete? So there are a lot of studies since then. I'm sure they have published even more studies that show that not only you can, but some athletes actually use that as a competitive advantage over their carbohydrate loaded peers. So there is something to that, and you can obviously research it more. So we talked about fruits and honey, right? And what are your thoughts about that? And because a lot of people in the carnivore community will only include those kinds of plant foods. Well, honey is not a plant food, but fruits, because they look at it as lower in anti-nutrients or plant self-defense chemicals. What are your thoughts on including that specifically for heart disease?
I mean, to me, the goal for heart disease is to be metabolically healthy, and there are lots of different diets that can create metabolic health. So I'm not really strict or dogmatic about any certain one diet. I do recommend against a lot of different diets because of nutrient deficiencies and things like that. I do think our diets are best centered around animal foods, but as long as a diet is preserving metabolic health, I think that's a diet that's working for you. We always have to take into account the plant toxin argument and the plant toxic factor, because those things, they do affect our health, and we have to pay attention to those things. It's not just about metabolic health. We have to look at the inflammation and the damage that some of those plant toxins can cause, and autoimmunity it can trigger, and that kind of stuff. So it really depends on the person, and what they can
too, right?
Yeah, definitely. And so like for me, I'm pretty low carb. I very little carbohydrate because I was a type 1 diabetic. It's just way easier for me to manage blood sugars without carbohydrates, like little to none. And so that's just what I do. So it's really just depends on the person, and people should also recognize that their needs and what works best for them is going to change as they change throughout their life, as they age, as they're going through different periods in their life. Like, we just have to take all that into account. And just because a carnivore diet worked for you amazingly now doesn't mean it will in 3 years. And then 6 years from now doesn't mean that it won't be the best thing for you again. It's just like our diets change. And, I look at things from an evolutionary perspective, and I do think that humans would have had access to things like honey and fruit in season, but it was not year round, and it was not as much fructose as sweet as it is now. Definitely more sour. And so we have to think about all that, I think that adding those types of things back in just encourage you to go off the rails a little more. If you find something that works for you, and then you quote unquote cheat, it just depends on your willpower, and you just want to set yourself up for success, so you don't want to be doing things that encourage you. Oh, I had a little bit today, it was okay, that means I can have some more tomorrow. And you don't want to be doing that if you have a goal in mind and you want to reach that goal.
Yeah, and you have to be aware of just how addictive the sweet taste is. It's not so much, it could be also the carbs and the energy you get, but the studies have shown that it's even the artificial sweeteners, it's that sweet taste that literally, your brain is throwing a party. And some of us are more prone to that. Obviously, my audience knows that I am like a big sweet tooth. So for me, a little bit of sweetness, the moment I finish that bite, I want more and more and more, So that's another thing that you want to be aware of. Do you feel like we missed any major message or topic that a general audience should know about heart health?
I can tell people like some of my biggest strategies that I've come across. I talked about diet and how that's a big lever, but my main goal in my book is to talk about diet, but also talk about all the other things that cause heart disease. And so psychological stress is a huge one, and I talk about that a lot in the book, and the imbalance in the autonomic nervous system. We touched on different environmental toxins and things like that, and plant toxins that can cause or contribute to the imbalances that create heart disease. But then I think I talked a little bit about the physics of the body too. And one thing that is commonly overlooked is that the light environment that our body is in, the electromagnetic environment that our body is in is really, really important to not just heart health, but health in general. And so practices that I include for those types of things are grounding, or infrared sauna, or getting plenty of sunlight, having positive social relationships, and those types of things. Like those are all really, really important things for heart health. We like to focus on diet and biochemistry, rightfully so. But there's other aspects of it too. And I'd like to broaden the conversation about heart disease.
That's awesome. Yeah, and they have things also for EMFs, like blankets that you can get, or things that you can attach to the back ends of your phone, and it really lowers the amount of electromagnetic frequencies you're getting. I haven't looked into how accurate those things are, but I feel it can't hurt to incorporate those kinds of habits. Do you meditate, or do you recommend people meditate?
Yeah, some sort of it doesn't have to be meditation, but it could be some sort of spirituality or mindfulness type of practice. I think is really, really important, just because of the modern world that we live in and how these unnatural stressors and how we have so many demands on our lives these days. And it's very useful. But I will say that, like, with stress, when research shows that the stress that's most damaging to our health is the stress that makes us feel like we're out of control or in unpredictable situations. So when you're looking at mitigating stress, like, yes, you can add all the meditation and all these different stress relieving practices, but the real important thing is to, as much as you can, remove those stresses that damage our health the most. And so look for those things that make you feel like you're out of control or in unpredictable situations, and try and mitigate those stresses, get them out of your life if you can.
Like a victim mindset, I know I spent a very long time, in that kind of mindset. It's just pure torture. I don't know why anyone would do it to themselves, but yeah, that can be insanely stressful, because being in a victim mindset basically says, I'm not in control. Things just happen to me. Why are these things happening to me? Why can't I have this, etc. So great. Where do you find yourself in the next few years and then beyond that?
Well, right now it's I'm in clinical practice. I run a very neuromusculoskeletal type chiropractic practice. But I'm trying to grow, like, my online consulting that I do. I'd like that to be bigger. I'd like to be speaking more. I will be speaking at KetoCon and the Wise Traditions conference this year, so I'm excited about that. But I'd like to be speaking more. I'd like to be working on the next book in the near future, which I haven't quite ironed out what it's going to be about yet, but I have some ideas. And yeah, just continuing to push these messages out into the world, messages that I think are very important.
Wonderful. Where can people find you?
Yeah, so my website is resourceyourhealth.com, and people can find my blog and my books, and my health consulting is on there. I'm on Instagram and Facebook and Twitter. It's just Dr. Stephen Hussey, Dr. Stephen Hussey. My book my books are on Amazon, and yeah, that's where people can find me.
Awesome. I'm going to link, obviously, all those things in the description box of this video so people can find you easily. Thank you so much, Dr. Hussey, for your time. Thank you, everybody, for sticking with us. And I hope this content was valuable. If you liked it, make sure you give it a thumbs up, subscribe, and hit that notification bell icon so YouTube alerts you every time I post a new video. Thank you so much for watching, and I will see you in the next one.